share perspective on additional breast cancer abstracts that are being presented at the 2018 ASCO annual meeting is Dr. Francisco Esteva, who is the Director of Breast Medical Oncology Program at NYU Langone's Perlmutter Cancer Center. Welcome, Dr. Esteva.
Thank you. Thank you.
So we're looking at the MONALEESA-3 trial here at the meeting, and it's one of the many breast cancer studies at this conference this year. Can you give some background on MONALEESA-3 and how does it, what potential does it have to change practice?
The MONALEESA-3 trial was designed to test the efficacy of ribociclib in combination with fulvestrant compared to fulvestrant alone in patients with ER-positive, HER2-negative metastatic breast cancer. And what's unique about MONALEESA-3 compared to other fulvestrant CDK4/6 inhibitor trials is that a large portion of the patients were treated in the frontline setting without any prior hormone therapy or chemotherapy. And this is the first study showing efficacy in a significant way for a CDK4/6 inhibitor in combination with fulvestrant in the frontline setting. In the second line also, it was very effective and better than fulvestrant alone, so the combination was more effective. But what I found more important in that it may add to the CDK4/6 inhibitor trials is the frontline ER-positive hormone therapy setting.
Definitely, great.
Yeah.
Now, there's also a phase 2 trial of sacituzumab govitecan that we're discussing at ASCO this year. Can you shed some light on that trial too?
Yes, sacituzumab is a very interesting compound. It's an antibody-drug conjugate, so it's basically targeted chemotherapy, and they have shown significant activity in patients with triple-negative breast cancer. So at ASCO this year, we saw a phase 2 trial that showed significant activity, an overall response rate of more than 30% in patients with ER-positive breast cancer refractory to hormone therapy. So those are the patients you would treat with chemotherapy, and an antibody-drug conjugate makes sense if it's effective like sacituzumab, because it would hopefully be less toxic than chemotherapy and is potentially very effective. So I'm excited about that.
Good. Now, what are some other interesting regimens in breast cancer at this year's ASCO meeting that you're really excited about?
Well, there was the Lotus trial with apartacilib, hard to pronounce, in combination with paclitaxel that showed some trend to increased overall survival in patients with triple-negative breast cancer. So that's kind of an interesting approach. There was also an ADC targeting an antibody-drug conjugate targeting HER2 that looks interesting. So there were a number of new therapies that are moving along. Also immunotherapies, for example, a poster, small trial led by the group at Yale showing a significant high pathologic complete responses in patients treated with pembrolizumab in combination with chemotherapy. So a lot of new stuff, new therapies coming out this year.
Definitely. So there, of course, there's a lot of excitement going on, and it's great to hear about all this research, but what work do you think still lies ahead?
Well, one of the most important trials, by the way, was the TAILOR-X trial, because we talk about new therapies and giving more chemotherapy. And in fact, TAILOR-X suggests that we can give less chemotherapy to patients with early stage breast cancer, particularly estrogen receptor positive, small tumors, node negative. But in the past, those patients, many of them were offered chemotherapy after surgery in the adjuvant setting. And the TAILOR-X trial for those patients in the intermediate range of the recurrence score by oncotype showed that chemotherapy doesn't add to endocrine therapy. So moving forward, we'll be giving chemotherapy to patients only with high risk breast cancer, which we can now identify with molecular tests, and do not give chemotherapy to patients with low or intermediate risk. So they will be treated with endocrine therapy alone, which is a huge advantage, less toxicity, same efficacy. Patients had an excellent prognosis, and basically is going to change practice.
Great.
Well, Dr. Esteva, thank you so much for being here with us today. We really appreciate it, and thanks for sharing your insight.
Thank you.